Hello and welcome to Health Reform Watch, a collaboration between Reuters and the Forum at the Harvard School of Public Health. I'm your host, David Morgan, healthcare policy correspondent for Reuters in Washington. And with me today is Professor Katherine Swartz of the Harvard School of Public Health. Professor Swartz is a leading expert in healthcare policy and management, and she's here today to talk to us about the stability of the Obamacare marketplaces as the Obama administration gears up for a new open enrollment period for 2015. Hello, Professor. Welcome to Health Reform Watch.
Thank you.
As we know, the Affordable Care Act set up healthcare exchanges or marketplaces in all 50 states where people can obtain private health coverage, oftentimes with federal subsidies depending upon their income. Now, these marketplaces got off to a very rocky start a year ago when healthcare.gov crashed on launch.
The problem has been that the website that's supposed to make it easy to apply for and purchase the insurance is not working the way it should for everybody. And I think it's fair to say that nobody's more frustrated by that than I am.
One of the big unknowns has been the health status and the financial reliability of the people who enrolled, many of them being low income and possibly new to the wonders of the health insurance world. So my first question to you, Professor, is what is it that you've been seeing lately that might suggest whether or not these marketplaces are proving to be stable and functional a year after the launch of the Affordable Care Act?
That's a terrific question, and it follows really on yesterday's news from the Department of Health and Human Services that in their preliminary numbers from 44 of the states, that there are 77 new insurers coming into all of the different marketplaces. So that's a 25% increase in the number of insurers coming in, and you would not see that kind of entrance into a market unless the insurance companies believe that they can make money in these new marketplaces.
Well, if the marketplaces are proving to be attractive for insurers, are there also indications that they are proving to be attractive for consumers?
That's another good question. I think the answer is yes. About 2/3, something like 65% of all the people who enrolled in 2014 enrolled in one of the silver plans, and the second lowest priced silver plan in any marketplace is what's known as the benchmark plan. That's the plan off of which these tax credit premium subsidies are based. And the preliminary data are showing that for 2015, the population weighted average of these benchmark plans is actually going to decline a tiny amount, a little less than 1%. Another 20% of all the enrollees in 2014 enrolled in the bronze plans, which generally are cheaper than the silver plans. So again, the preliminary data are indicating that while in some marketplaces premiums may rise for some of these plans, in other marketplaces they're going to fall quite a bit. So that on average, for most people, they will not see big differences at all. And in fact, if they're choosing a silver plan and choose one of the benchmark plans, they won't see an increase at all in their premium.
Now, how well is the performance of the silver plan likely to reflect the performance of plans that are not in that category, that are in no way benchmarks for the market, but which people might have an interest in enrolling in?
So that generally would be one of the gold or perhaps even a platinum plan, although some states are not allowing the insurers to offer platinum plans in 2014. I think that we don't have enough data yet in these preliminary analyses to look closely at the gold plans. So most of the attention has been paid to the silver plans and bronze plans. Within the silver plan category, there are some plans, and it's also true of the bronze plans, where premiums may rise. But in other places, they're going to fall. So it's very hard to say in a generality what's going to happen to people. I think they're going to have to look closely at what their premium might be this year and then look again at what it would be in 2015.
Does that reflect at all, do you think, on whether the underlying population of enrollees is young enough or healthy enough to sustain these marketplaces going forward?
I think it reflects that. I think that the insurers are pretty comfortable in the silver plans in terms of the types of people that they're seeing enrolling in 2014. I also think it reflects pretty intense competition in the silver plan category. The fact that we've got more insurers coming into this market for 2015, and it's important to note that among the new entrants, we've got some of the very large national insurers like United Healthcare and Cigna going into more of the marketplaces. Because they have such a large number of enrollees throughout all of their business, have been able to do a very good job of holding down reimbursement rates to hospitals and physicians. So the fact that they're coming into these markets, especially for the silver and bronze plans, I think is very good news for everybody.
Now, as you mentioned earlier, the Department of Health and Human Services last week announced that 7.3 million people are enrolled in the marketplaces and are up to date on their premium payments, which is a larger number than some experts, including administration officials, were expecting earlier this year. Can you elaborate a little bit on why that is an important figure?
I think this indicates that the people who are coming into this market very much want insurance, and they're doing everything they can to pay their share of the premium. Many of these people are, of course, getting the tax credit premium subsidies, but the fact that they're not lapsing, they're not forgetting or not paying on time their share of the premium is a really strong indicator of stability in this market, I think. And if again, going back to if I were an insurer, the fact that there's stability here would be a very good reason to come into this market. I wouldn't worry that people might not pay. And secondarily, or just as important, it indicates stability of who is actually in the risk pool. You don't have a lot of people coming in and going out who might be healthy, and you want them in this market. So the fact that such a large proportion of people are paying on time really is a strong indicator of stability here for the risk pools.
And so if the indications are that there's more interest on the part of insurers to get involved, that the premiums are not skyrocketing as many people feared they would earlier this year, and that the consumers are proving to be more reliable financially than was expected, where does that leave the administration now as it prepares for open enrollment start on November 15th?
I think it leaves them in a very strong position. I think that the people who enrolled this past year are very likely to re-enroll. I think that the hope that we will get another 5-7 million people to enroll this coming year who may have stayed back on the sidelines thinking that this wouldn't work so well, they're going to look at these numbers and say, this looks stable to me, and the fact that we have more insurers offering more options and that the premiums are not rising, as you just said, way out of bounds, I think this puts the administration in a very strong position. That said, I think it's really important for the states and the administration to continue all of the efforts with assisters, the people who are helping new enrollees and many of the people who are going to have to look closely at whether or not their own choice in 2014 may have had a higher premium. These assisters will be very important. This is only the second year of these new marketplaces. And as an economist, I would tell you that it's really gratifying to see all of this competition and the fact that the competition is leaving premiums not rising. So it's important to make sure that the consumers also get help in understanding what this means for them in terms of their net premium after paying, after getting the tax credit subsidy, and what their choices really are. But this is very good news. It's also very good news for taxpayers. It's very good news for taxpayers because the benchmark silver plan is what is the basis for the tax credit subsidies. And the fact that on average it's going to decline by a little less than 1% means that all of us as taxpayers will not be paying a lot more to subsidize the enrollees in these marketplaces.
Thank you, Professor, for putting us in the picture about the Affordable Care Act's marketplaces and the prospects for open enrollment. Thanks also to our viewers for tuning in to this edition of Health Reform Watch. I'm David Morgan. See you next time.